We are on to the next slide that is talking about documenting program eligibility. It's very important for our funders, including the Department of Human Services, to ensure that the clients that you're serving are the eligible participants for their programs. So in the client's file, you have to be able to document that the client meets the homeless, at risk of homelessness, or low income status. So this is another reason why you need the income verification that was talked about in the previous file with paycheck stubs or income employment information. That's so that they can see that they meet your criteria. Also, proof of homelessness or at risk of homelessness proof needs to be in each person's file, whether that's a form or a letter from emergency shelter or an eviction notice, whatever that is that shows that the client is either homeless or at risk of homelessness. You need to make sure that also documented in the file is the need for supportive services. I can't stress enough that supportive housing is not just affordable housing. There needs to be a need for supportive services with the affordable housing to make it possible for that person to maintain housing. So when you're documenting the need for supportive services, that would be like a proof of a disability, if a person had a mental illness or a substance abuse issue, if a person had chronic physical health problem like HIV/AIDS or some other thing that would affect their ability to maintain their housing. You could show this in the assessment portion of the file where whatever your assessment is that looks at a person's need in every area of their life. There should be multiple areas of need so that you can prove that this person, this individual needs the services and needs to be placed into supportive housing because of that need, because of those disabilities and chronic health conditions and chronic issues, lack of education, low income, very little training, low job skills, along with a myriad of physical and mental health disabilities. You have to document. Lastly, you need to document that the clients your agency is serving aligns with what you have in your funding plan. So if you submitted a funding plan to the Department of Human Services, Bureau of Homeless Services and Supportive Housing, which everyone just did recently, you outline in there who you're going to serve, why you're going to serve them, and that is approved by the Bureau. So you need to make sure that within the files for the program that you are getting funded for, includes documentation of the people that you said you were going to serve and why you were going to serve them. I mean, that makes sense, right? They should all fit together. But many times, that funding plan is put together by someone who is not delivering the direct service, and so the direct service person, like the case manager, doesn't know what their boss said that they were going to be doing and who they said they were going to be serving. So please make sure that you know who it is that is supposed to be in your supportive housing, who you're supposed to be serving, and that you are choosing and documenting people that need to be in supportive housing, not people that need affordable housing. We know there are a lot of people that need affordable housing out there. This is a special kind of affordable housing that is only for people that have a significant need for the supportive services to be able to maintain the housing. The next slide highlights the components that should be included in every client file. A lot of agencies, personally when I used to run programs, we would have a client file checklist at the beginning of our file, or we actually had a little label that we put on the front of our file that we were able to date and check off all the items that we needed to be included in the file to make sure that we didn't miss anything. This provides the case manager a quick list of what could be missing, and that way they make sure that when they are meeting with the client, they obtain all the information that they need. Included in this list is all the things that we've discussed throughout the presentation, right? The client service plan or the individual service plan, case notes. Are your case notes clear and understandable? Are they dated and signed by the case manager? Are there short and long-term goals somewhere on the service plan or on a short and long-term goal sheet or somewhere included within the planning documents within a file? There should be short and long-term goals. Referral forms. If you have referred people to services throughout the community, you should have referral form copies in their file. Incident reports. if that's applicable, if they have had any incidents that occurred that should be documented, like hospitalization or disturbance of neighbors or encounters with the police, or anything that needs to be an incident that has been looked into and reported on by the staff. I want to touch on a couple of key areas that are lacking oftentimes and that are very important when you talk about documentation, and we'll be spending a lot of time practicing skills related to developing these in the in-person training. So the first one of those is the individual service plan. The individual service plan should flow from the initial assessment and intake for the client, and it should address every area of a person's life. So I'm just going to name off a few areas that could be included, and this is not all inclusive. Education, employment, mental and physical health, family, transportation, mainstream benefits, budgeting, substance abuse, child care, et cetera, and the list goes on. So a good individual service plan takes all the information of the assessment and takes all the deficits or needs that are in each one of those areas and puts them into an individual service plan with input from the client or tenant, and that way you can begin to start to sort out your short-term and long-term goals within each one of those areas. Now, you may not be working on every area of a person's life at the same time because that's a little overwhelming. Not many of us can concentrate on everything that we need to change about ourselves or improve at one time. So that's why it's important to have this really good living document that you can then continue to keep working off of. You might have 3, 4, or 5, or even more short-term goals within one long-term goal. So one of my favorite examples is we always say that people need to get their GED. If they need to get their GED, it takes a lot of steps to get to that point. So there will be a lot of short-term goals, like finding out where there are classes, getting transportation to class, enrolling in class, getting books, attending class, taking the pretest, retaking the pretest, taking parts of the test, studying, attending class. All that stuff is going to continue to be short-term goals until you finally, hopefully, get to the point where you've obtained your GED and you've finished that long-term goal. And then you might start on an employment piece, or you might go to the further education and go to a training program or go to a college program that would help you get a living wage job. These are just some examples, but it's a way to think about each piece. And so it's important in the individual service plan to have it flow directly off of the intake and assessment so that you are taking where a person is at and where they want to be, and you're able to put that out in the individual service plan with short-term and long-term goals. Then the next piece that is very important is case notes. Again, we're going to say the tried and true phrase, if it's not written down, it didn't happen. There is no one from IDHS following you around with a helicopter recording what you're doing with a camera. They don't know. They can't see anything except for what you have written in their files when they come to monitor you. So your case notes need to be current. They need to reflect case management provision as indicated in your reports and funding plan. So if you say in your funding plan you're going to meet twice a month with someone, you need to have case notes that say that you have seen someone twice a month. Now, you can have case notes that say you've seen them more, but you need to at least meet the minimum goals that you've put in your funding plan. This is not a novel that we're writing in a case note. It needs to be succinct information about what happened during the meeting. You don't have to be a court reporter and take down everything the person said and everything that you said. What you need to do is concentrate on the areas that you're talking about in your individual service plan. So if you're using that service plan as your template of service, then you're going to talk about whatever short-term goals in whatever area they're working on towards the long-term goals. So that's what you should be talking about in your case note. So your case note should be reflective of the individual service plans and the goals that you have worked together with the tenant, client, consumer, whatever you want to call them, to provide the framework for your relationship. It's the case note that helps you then remember. If you've got 30 households on your caseload, you can't possibly remember what you talked to that person about last week. when you met with them. So your case note helps you go back and be an efficient case manager by reviewing that before you go meet with them again, and then being able to carry on the conversation and carry on the service from that point, rather than starting in the middle or, you know, somewhere way back at the beginning again. You can start from the point that you're at. This really is a tool for you. It is not a punishment. It is a tool to make you a better case manager and make you be able to make sure that you're helping the tenant stay on track with the accomplishments and the things that they're working towards. So one of the things that we have underlined on this slide is case management contacts and attempts. This is really important in your documentation because, as we all know, clients who live in and need supportive housing can be service resistant sometimes, especially after they've been in supportive housing for a few months, and my immediate need has passed and I forget kind of where I've been. And so it is still the responsibility of the agency to reach out and attempt to re-engage and continue to engage the tenant in services that they need. Whether this is a phone call, whether it's stopping by to try to catch the person at home, whether it's leaving them a note underneath their door, whether it's waiting at the mailbox when people come down to get their mail, whether it's waiting at the school bus stop for the kids to get off the school bus because you know that the mom is going to be there to pick them up. You've heard me say it before, I call it polite stalking. Sometimes we have to do everything that we can to re-engage or to reinvigorate the client case manager relationship. This is instances of case management. Even if you're not able to connect with that person at that time, this is you doing your job trying to connect with the person. So you need to make sure that you're documenting every time that you attempt to connect with the person to show that you have been working in getting that person into the services that they need to be involved with. It's really, really important that you document these attempts and that you date them and that you count them on your reports because they are instances of case management and that you are making the service available to the people that need the service in supportive housing. Lastly, if your client leaves supportive housing and goes on, either is able to go on into less supported housing, or they are exiting due to some bad reasons sometimes, you need to include exit information about the client in each file. So when you enter data into your quarterly report, you want to make sure that the data that you're entering aligns with the data that you have in your client files. Now, they're not going to come in during a monitoring visit and try to count up 9,999 case managements that you reported in your client files, but they can tell when they look at a few files that have very few instances of case management documented that the number you have on your report is not right. They've been doing this for a long time. They're smart ladies, and they know, when things don't jive. So you got to make sure that you are giving yourselves credit for everything that you are doing.